couldn't see him. I couldn't see him because of these mics.
Yeah. Oh, that's,
We'll bring him up closer.
that's awfully wide.
Just bring him closer up.
That's awfully
Do you want me
wide.
to sit in there, Matt? Frame it. You got some?
Yeah, that's quite.
It's pretty wide.
Jump on your camera. See, just talent here, talent hopefully right there.
Up you guys, I'm happy, but actually,
Yeah, alright, that's right. That's alright. I'll go over it.
Two. I was actually thinking about that story today. Just about approaching that, looking for a line.
Yes, yeah, cool. It's going to come through. Alright, we're up live.
Anyone follows?
Yeah, we're going live too.
Okay.
Matt?
Sorry, just lost our sign language interpreter. Come on up here, Andrew. Oh, kia ora koutou. Welcome not to the Ministry of Health this time, but to another health facility. Thank you very much for being here for the media stand-up. With me today I have Andrew Slater, who's the Chief Executive of the National Telehealth Service, which operates Healthline. And Andrew's going to make some comments, and then you may have some questions you want to direct to him as well. Thank you again for including the sign language interpreter in your picture. Andrew will talk in particular about the self-isolation registration process that we've had in place since last Friday. I can begin by confirming that we still have no confirmed or at this point in time suspected cases of novel coronavirus in New Zealand. You may be aware, and we've covered this in previous media stand-ups, that we now have 3 laboratories in New Zealand that are able to test 7 days a week, 24 hours a day, and those are in addition to ESR in Wellington. We have the Auckland Laboratory, Auckland Hospital Laboratory, and the Canterbury Health Labs in Christchurch, so we have plenty of testing capacity. And so far, upwards of over 50 tests have been done that have come back negative, and there are a number of tests at the moment that are outstanding, and we're waiting for those results. I should confirm, though, that none of those tests are on people that fully fit the suspected case definition, but as ever, we are taking a precautionary approach there, and that is a decision to test based on the clinical presentation and the advice of the doctors looking after those people. You may have read that overnight the World Health Organization determined a new name for novel coronavirus. It's called COVID-19. Easy to say, and there's some rationale for why they've gone with that name, and from now on we'll be aiming to use that term when we're describing it. And the WHO Director General, in announcing this, also made a couple of other key comments that I'd just like to emphasise. First of all, he asked countries to be, and I quote, as aggressive as possible in fighting coronavirus. And he also said that he was very clear that the coronavirus, COVID-19, is a very grave threat. So again, I think that emphasises the approach that we are taking, which is a very strong approach, a lot of planning, very precautionary approach around the border measures is appropriate, given that, as the WHO Director General has said, this does present a very grave threat. Now, those comments were made by Director General Tedros at the WHO during a meeting that's currently underway in Geneva around innovation and research, specifically to look into what are the key research questions and how might we answer those around COVID-19. And New Zealand is represented at that meeting by Professor Sonny Collings, who's the Chief Executive of our Health Research Council. So we will be directly involved in the discussions there and in participating in, where appropriate, any research that might arise. Tomorrow, our Technical Advisory Group is holding its meeting again to look at any newly emergent evidence. And my final comment before handing over to Andrew is just around the register that Healthline have stepped up to run. It's been operating since last Friday on the dedicated 0800 number. It's been great to see the strong support from people in self-isolation who are registering there, and that gives us an opportunity to provide them with up-to-date information and, of course, to know just where these people are, and that helps our overall planning and response. So my pleasure now to hand over to Andrew, who is the Chief Executive of the National Telehealth Service. Andrew.
Kia ora koutou, and thank you. Ashley, as Dr Bloomfield pointed out, the register has been running since Friday and already numbers are strong, and today we're seeing similar levels of registration as we saw coming through yesterday. Up to midnight last night, 1,897 people have registered as being in self-isolation, and yesterday alone we saw 437. On 11 of February, so that was yesterday, our total call numbers were about 51% higher than on the same day last year. And of the people calling related to coronavirus who did disclose some information, 44 of those callers were experiencing cold or flu-like symptoms. But what I can say is Healthline has not referred anybody or spoken to anybody that meets the clinical criteria to be tested by the Ministry of Health. 88% of the people that spoke to us yesterday received self-care information or advice relating to coronavirus. Many people that were calling us yesterday were wanting advice about schooling and universities, especially as students return from summer breaks to tertiary institutions. And a number of people wanted to know information about how to manage travel plans and travel information. It remains very important for those people who are intending or plan to go into self-isolation to register with our service, and it helps us and the Ministry to support New Zealanders' overall response to coronavirus. But most importantly, it means that those people will have access to regular checks on their welfare and well-being. From today, the Healthline team will start to make contact with people who have come into New Zealand either from or through China since the 2nd of February and who aren't among those that have self-registered as being in self-isolation so far. And we will be asking them to self-isolate. And I think that ensuring anyone that has concerns or needs support, the top priority is for us to be answer those calls and inquiries when people call us on that dedicated number. We know that there's been a lot of talk about the uptake of the register, and I think it's important to reiterate that this is a new initiative which has been resourced by additional capacity within the National Telehealth Service. And I'm really pleased with the level of uptake that we're seeing. And I know that as we start this proactive follow-up, we'll be able to get more people onto the register. So yeah, happy to take questions for either of us.
Questions?
Would you like to talk at all about concerns that people who have come from China are not even using the service or are not registering themselves at all or are not even aware of the service? I mean, you know.
Well, I would be very surprised if people aren't aware. We've been very clear in the communication about this. It's been regular and through a range of channels. And for people who haven't either taken up the opportunity or had the opportunity yet to self-register. That's exactly why we are now using the data collected at the border since the 3rd of February to proactively contact those people and get them on that register.
Quite a jump in numbers, which like 2 days ago it was still sitting around 400 registered as self-isolated. Why do you think suddenly there's been a huge spike in numbers?
Look, I think, we've made sure that we're getting information to people about the process as they arrive in the country, and secondly, yourselves helping us get that message out there to the community.
So if we're saying roughly 4,000 people have not registered, how long do you think it will take to be able to get through those and make sure they're all contacted?
So we're starting contacting those people today, and we anticipate we should be able to work through that list within the next 48 hours.
And what happens if you ask them to self-isolate and they say no?
So, as you're all aware, there are powers under the Health Act to require people to self-isolate. If people are not taking the opportunity and the advice and the expectation, they will self-isolate. And let me be clear, and I've said this before, our experience is people understand the importance of that. But if they're not, then we would be asking who those people were from Healthline and following them up and seeing if we needed to take any further action.
Has the Ministry of Health had to essentially force anyone to self-isolate so far?
No, we haven't, and I think the extent of the response of people voluntarily self-isolating and registering is encouraging and demonstrates that in these situations our strong experience is people see the importance of it and are quite happy to do that. Well, they may not be happy. Self-isolating yourself for 14 days is no small ask, and we accept that, and that's one of the key reasons we wanted Healthline to be in touch with people to make sure that they are able to access food, that they've got the support they need.
Are you monitoring those people who are in self-isolation?
Yeah, so what we are doing is we contact those people that have maybe more distressed or have welfare needs that have identified those in their first call. So we're contacting those people daily, and then those people that are very confident and clear about self-isolation and we're comfortable with that are getting follow-up every few days in the outbound calling. So we're just starting to do some of that second group over today and tomorrow.
I'm just wanting to check in on the whānau people up there. What's the latest on that? And I understand there was a possible talk of repatriation.
Yes, so around nearly 60 of the people there are from countries other than this one as their country of domicile, largely the Pacific. So there's a lot of planning going in, working with Ministry of Foreign Affairs and Trade to make the plans to repatriate those people at the end of the 14 days. And of course for those who are New Zealanders to get them back home, and you can imagine they're looking forward to that. Look, what I can say is the team up there, which is cross government, we've got Red Cross involved, there is a range of agencies, are working really hard to ensure that that's as pleasant an experience as possible for people. Yeah, I'm really pleased, and the feedback we're getting from those there is positive. There are some social events planned. Of course, these are social events with a high level of precautions around distance, keeping a distance from people, but there's a lot of effort going in. I think that's been well appreciated.
And do you have any plans to monitor cruise ships that are coming in? I understand Tonga's put a ban on some entering, docking there. What's New Zealand's plan with that?
So right from the start, cruise ships and other maritime traffic has been part of the planning. There is already a very long-standing international protocol around any ship entering a port needs to declare if anyone on board is unwell. It's called pratique, and of course at the moment there is a very high level of awareness of this, and so all cruise ships have their own medical staff on board, and they will be checking on people. So if there are any that are symptomatic and there's any suggestion that they could have been exposed to coronavirus, they will have already acted very quickly to ensure that that person is self-isolated. So I'm very comfortable with the arrangements in place around not just cruise ships but all ships coming in.
Just going back to the people in self-isolation, you said you're only checking in every other day on the people who are confident with what self-isolation was. I mean, how are you actually monitoring that these people are following, not just kind of leading you up the garden path with what they're saying, what they're doing, you know? Are you just trusting what these people are telling you, or?
Yeah, I mean, this is a high trust arrangement. And again, it's not unusual. The registering and regular connection with people is not about policing their self-isolation. It's checking on their welfare and well-being. There's very good information on our website around the practicalities of self-isolation. These people are not confined to their bedrooms. You know, there's just good advice about how they can, as much as possible, get about their daily lives while protecting themselves and their families and the wider community. Andrew, did you want to supplement that?
Yeah, look, I think one of the things that I would say after talking to my team is that people are taking this responsibility very seriously and have understood what it means and making sure that they follow those guidelines on the Ministry of Health website. So I've been quite encouraged by what we're hearing from people, and there's certainly good processes to make sure that people are aware of what it means at the border as well. So certainly to date, we've seen a high level of commitment to following those guidelines.
Do you think concern then, you know, that other people might have of the people who have come back in from China, say that these people aren't following protocol is legitimate, or, you know?
Yeah, look, what we've had a number of people call us to talk about those concerns, and so I think if people have concerns in the community about people that should be self-isolating, they should, in the first instance, have a polite conversation about that with them. But if not, certainly give us a call, and we can help you determine whether the person should be in self-isolation and provide some further guidance based on that information as well.
Are you getting many calls like that at the moment, or
Look,
people reporting other people, I mean?
So we've had some people contact us with that, and more often than not, it's been perhaps a misunderstanding of the guidelines or a misunderstanding of the dates and things in the first instance.
Okay. Perhaps one more question, if there's anything.
Healthline, how many staff do you have working currently phoning people up?
So that number's changing hourly based on demand and based on our lists of people to call back. So within the National Telehealth Service, we have over 450 staff that we're able to flex up and things. We're also reaching into some of our partner organisations to bring in some additional capacity, particularly those that speak Mandarin, to be able to connect with people.
Can I also just quickly ask for an update on the 11 New Zealanders on the Diamond Princess which have not been taken into quarantine? I mean, are they still on the ship? Have they been diagnosed with coronavirus as far as the ministry is?
So the information I have is what I have read in the media, which you'll be aware of as well. But you will be aware there was a large increase in the number of people with confirmed novel coronavirus infection that came through overnight. The latest information we have is that there are only the 2 New Zealanders who have tested positive. They are being cared for in a hospital facility. The others are undergoing the same on-board isolation procedures that all passengers are, and my understanding is that the Japanese authorities are requiring everybody to see the 14-day period out. So thank you very much. Again, appreciate you attending, and thanks for your ongoing support.